medicine, we have a certain, I don't want to call it bias, but by training, we think this is our body of scientific evidence. And, um, is there another framework that we can look at issues that are causing problems in the human condition? And can they be altered in other ways that traditional Western medicine doesn't know of? And I think that possibility certainly exists. But I couldn't comment on the validity of what she did because I don't, or he did, because I don't know, I don't have any knowledge of that. Does that make sense to you?
Yeah, sure. Thanks.
Dad, can you talk about endometriosis and also about ligament laxity during menstruation, like during the regular monthly cycle?
Yeah. I'll, Let me do the second question first. When the uterus, right before, it's getting ready for pregnancy, and there's some swelling of the uterus. So women typically will feel a heaviness in their pelvis as the uterus kind of swells up. It's more edematous, you might say. Okay, just because it's getting ready for pregnancy, and those symptoms can certainly be real, and there can be some perceived laxity, not so much of the ligaments, but just a heaviness related to the uterus. If you take a uterus out, we can't do this, but I would postulate that if we took a uterus out right before menstruation is going to start, that that will weigh more than a uterus at the end of menstruation, at the end of a period. So I think those things that you feel are real. And the first question was about endometriosis. Endometriosis is a condition where the inside lining tissue of the uterus, the endometrium, the tissue that grows each month in response to the ovarian hormones and gets ready for pregnancy and then sloughs out, that grows outside of the uterus. It grows back behind the uterus, typically along the uterosacral ligaments, but it can occur anywhere in the pelvis and even out of the pelvis. I've had a case of a woman who seemingly had appendicitis every month. Well, what she had was an implant of endometriosis on the tip of her appendix when I operated on her. So that was, and you can get endometriosis that occurs in C-section scars. You can get it in the umbilicus. And so it can occur in other places, but typically it's in the pelvis. Now, what happens is when a woman's, during her cycle, when the inside lining of the uterus grows, then this ectopic, this endometrium that is somewhere where it's not supposed to be, back behind the uterus or on the uterosacral ligaments or elsewhere, starts to grow too. And then the hormones that support it near the end of the cycle, they taper off, and that lining that would slough out of the uterus, it bleeds into the peritoneal cavity because that's where it is. And the body, because of that blood being in a location where it's not supposed to be, and that tissue being in a location and it's now bleeding, sends an inflammatory response. That inflammatory response causes pain and scarring. Okay, so those are the typical hallmarks of endometriosis is pain right prior to and with your period. Okay, that's typical of endometriosis. And over time, that causes scarring. And sometimes the endometriosis is under the capsule of the ovary. So each month you have bleeding that's trapped under the capsule of the ovary, and old blood looks like chocolate syrup. It's initially red, but it turns and looks like chocolate syrup. Those are the so-called chocolate cysts of endometriosis. So we can see those on ultrasound. They have a pretty typical appearance. First of all, they're a cyst on the ovary, and secondly, they have a kind of a ground glass appearance that is typical. But a lot of times, a patient can have little implants of endometriosis throughout the pelvis and have pain And there's nothing on ultrasound to tell us that. So to diagnose it, we've got to look inside. We've got to do laparoscopy. But endometriosis is a fascinating disease, and it can be associated with infertility. There are a minority of cases where the infertility is explained because of scarring of the tubes and they're blocked, but the vast majority may be minimal endometriosis, and they are associated with infertility, and we don't know the exact mechanism. We know that if we treat the endometriosis, the patient's chances of getting pregnant are much improved. So, and one last thing, the amount of endometriosis does not correlate with the degree of pain. I've seen patients that had large endometriosis in a pelvis, large endometriomas of their ovaries, and pelvis full of endometriosis but had very little pain, and other patients that have minimal endometriosis and have a lot of pain. Okay, any questions about endometriosis?
I find it fascinating about the uterus and how you would say it was heavier. And that makes a lot of sense why, for me anyway, when I go to do a heavy squat in the gym during my time a month, I literally feel more pressure pushing down. And it's almost like I don't have the pelvic floor support. It's not terrible because I don't have prolapse, but it's something I notice. And it's one of the things that I always tell people, like, don't go as heavy during that time of the month. But for me, it was always more of a feeling. But hearing you say that it actually would weigh more at a certain time of the month makes a lot of sense.
And there also may be something hormonal, Katie, about the ligaments and about their laxity during that time of month that may play a part in what you experience as well.
So you're saying that there could be more ligament laxity just during that time of month that's also making it more difficult?
I'm saying that's a possibility. I don't know of any evidence or anything, but I suspect that could play a role.
Just like...
As well as the fact that the uterus is just engorged just prior to the period. It's engorged.
And that usually happens on what day?
Well, I would say it happens just prior to your period and maybe during your period, and then begins to be relieved at the end of your period, going into the next part of your cycle.
Okay.
And that's all mediated by hormonal changes, by the hormones produced by the ovaries, estrogen and progesterone, and they in turn are mediated by the LH and FSH that are produced by the hypothalamus, follicle stimulating hormone and luteinizing hormone. So it's too far afield to go into all that. Some of you may have studied that in biology and remember a little bit of it.
Yeah, thank you. So if anybody has any more questions, I'm just going to take one more. But Dad, I really appreciate this so far. It's been amazing and such a good, just overview of all of these things that I don't know much about and haven't taken coursework on. And so it's always good to understand what exactly is happening when we're working with people. I feel like I'll be more educated and cognizant of what's going on.
I have a quick question.